let's go ahead and get started. So I'm Angie Gallagher. I work at BurstIQ. Can't thank all of you enough for being here. I want to introduce Alicia Parker. I know you thought you were going to be silent here, but you got to say hi.
Hi, everyone. I'm Alicia Parker. I work for Empiric Health.
That's right. And so, as you can see, oops, my goodness, that was my phone. Excuse me. So then, Rick Adams, I'm introducing Rick Adams and also Frank Ricotta. And I joined BurstIQ about a year ago. And one of the things that compelled me to joining BurstIQ is this project that they did with Empiric Health. And it was something that if you're in the Denver scene, many of us are aware of the BurstIQ and Empiric partnership. Incredibly compelling demo that they have in terms of what they were doing. So Rick is a serial entrepreneur. He's had 4 successful exits. Empiric is his 5th business. And then Frank, he has owned 3 prior businesses, and BurstIQ is his 4th. And I'm going to kick it off with a question to you guys. And then, Alicia, you do want to get to the bio page, the next one. There we go. So there you can see some of the companies that they were in. But let's kick it off really quick with how long have you guys known each other? And let's just start with that context, because I know you have a long history.
Since 1990, roughly.
Oh, Frank's on mute.
Yeah, 1990, and a bunch of capacities since then. But when we first met each other, was Rick had started his first company after leaving Goldman, and we were pretty excited about that technology as an integration company, and really started to use it for a lot of our clients, and we've been friends ever since.
Very cool. And it seems that you guys have had a lot of parallel situations in your lives. You both you were both involved in the military, so you have a strong background in that, and then just kind of continued along in sort of different spheres, but also crossing over with a lot of different industries.
Well, yeah, that's true. I went to the Country Club Academy, though.
Right.
So.
The fun part is we've taken turns where Frank was my customer, and then we were in the same company together, and now I'm his customer. So we've been on all sides of this.
And we still talk to each other. That's a good thing.
Very cool. Well, I think everybody had a chance to kind of read the slide here. So let's go ahead and move to the next one. And Rick, go ahead and give the overview of Empiric.
Sure. I think most people in healthcare know Intermountain Healthcare. Intermountain's unique in the sense that they've always wanted to do the right thing for patients and payers, even before it was financially popular. In 2013, they started a program to try and take unwarranted clinical variation out of surgery. And over the next 4 years, they saved $90 million in uniformly improved outcomes for the patient. So for example, across the whole system, they took a full day off of length of stay for knee replacements. They, once again, with their mission perspective in 2017, thought this methodology was valuable enough to the healthcare system. They decided to commercialize it. And so they hired me to pull the internal methodology out and take it out to the market. Across the bottom, you can see some of our other clients that we've been able to serve over the last 3 years. We have about 50 staff distributed across the country. We have a strong data sciences team in Denver, and we have a strong data operations team in Salt Lake City, where we pull data from our clients. We've developed very, very strong data science, artificial intelligence, and what we're up to is going to surgeons or surgical teams, showing them very clean data, showing them surgeries are apples to apples, where it's essentially the same patient. And there's no reason why the cost should be different or the outcome should be different. And then we show them what their choices are. And very often surgeons make smart choices about making surgeries more affordable and improving patient outcomes. So that's the journey that we're on. Frank?
Oh, my turn a little background about Burst. So Burst, little founding story. So we started the company back in 2015, and a lot of the premise was by me, along with a lot of others, kept getting notices from various companies, credit card companies, and even some of our health companies. And I received a notice from the Office of Personnel Management that said, "Oh, your information has been hacked." And for those you don't know that's the organization that really does all your background check while you're in the military, or if you have any kind of security clearance. And I thought, well, if they can get hacked, and we're seeing more and more energy against taking people's personal information and monetizing it on their own, wanted to go do something about privacy. And actually working with Rick just before that, we realized that healthcare is the most valuable data on the planet. And we wanted to focus on really liberating a lot of health data that's locked in these existing systems, so people can do really advanced things with that data. And Empiric's a great example of really providing a lot of artificial intelligence and machine intelligence to data to produce really measurable and measurable outcomes and have significant impact. So what we say is we like to build immutable profiles of people, places, and things really at the data level. We process. We're a blockchain-based platform. We're HIPAA and GDPR compliant. Probably run through 50 billion data points through the system at this point in time. We also have a really great innovation community. I recognize a few names out there. So right now, about 100 plus projects building apps on the platform these days, and a really good portfolio of strategic partnerships with the Department of Commerce, International Trade Administration. We're the first blockchain company in the UN Global Compact, and we do quite a bit of work with regulatory teams, both on the fintech side and the healthcare side, on how to adopt some of this new emerging technology.
Very cool. Alicia, do you mind going to the next slide?
So let me talk a little bit about collaboration. First of all, I think all the great innovations really don't come from what's called the great man theory, like a Steve Jobs or Elon Musk. I think they come from collaboration. And collaboration used to be hanging around the lunchroom together. Now with tools like Slack and Zoom, we can collaborate from any place. But as I mentioned, 2017, I needed to commercialize what Intermountain did. The stuff they did was extremely powerful for them, but it was essentially built for internal use. So there were some batch programs, a lot of Tableau. When you present to a surgeon, it was sort of hand custom, PowerPoints, that sort of thing. So it's a big data issue, or at least a medium data issue. To get apples to apples surgeries, Intermountain had developed 40,000 rules or algorithms. The surgery must always have this, it must never have that. It might have the secondary procedure or not. Those rules were all in Excel spreadsheets. So obviously we needed to put in a powerful rules processor. And it's essentially a big data problem where you're ingesting millions of surgical records from a hospital, getting them all sorted out, getting them organized, and putting them through a rule processor. And to Frank's earlier point, it has to be HIPAA compliant, ultimately high trust compliant, because you can't let that kind of data get loose. So I could have spent a year or two just sitting down and going through all the primitives and plumbing infrastructure to do that. But luckily for me, while I'd been doing something else, Frank had put together a platform that had all those basic features already in place. Had a very high performance ingest engine, data quality, got data organized, you present it back. In 2017, you would immediately go to the cloud. So Frank was up in the major clouds, Amazon cloud, the Microsoft one. So I was probably able to cut 18 months off the development time, for taking this out to clients by platforming everything on top of Frank. This week, actually, 3 years ago, I was the first staff member into Empiric. So my huge IT team was zero. And so as we started hiring people, Frank had great software engineers working for him. Some of them had worked for me before with Frank, so I knew the folks. And so before I could build up my own team, in addition to the platform, the initial custom work we needed to do was done by BurstIQ. So instead of taking 18 months or 2 years to get to market, we're out in the market 6 months later. So I think that's just a fabulous example of collaboration. And obviously, Empiric and its investors are better off. But I premise that the healthcare system's better off because we got a really valuable tool that is good for patients and good for payers, and got it in the market a couple of years earlier than if we'd tried to do it all ourselves. So I think that's a great example of collaboration.
Yeah. I do have a few follow-up questions, but Frank, why don't you talk about collaboration and why, even around the office, I always hear you say you definitely feel that it's the future for the success of growing businesses. So I'd love for you to share with everybody your ideas on collaboration.
I mean, I'll echo what Rick said. I don't think you get anywhere in today's world without collaborating. It's too complex, and there are so many moving parts, particularly within the health space. What we receive back, we had a good technology platform. What we receive back is real live insights and how technology could be applied and impacted and accelerate an emerging startup that had really had the tiger by the tail on Intermountain from the standpoint as having to satisfy one of the top health systems in the world, really, with taking some of their own IP and turning it into commercial product and bringing it back to them. So in our collaboration environment, back and forth is understanding how Empiric, by extension, their customers use the platform, to what it meant for us to help an emerging growth company through their own individual cycles, and what we needed to do to support them and help them mature through their various aspects of growing the business. And in turn, it allowed us to really mature a lot of aspects on our side of the business and pushed us down a couple paths from a technology perspective that was really beneficial in the long run in terms of bringing what we wanted to bring to the market as well. And last, it always works well. I've always had a philosophy that good deals come together easy. I've had that philosophy for a long time. Anytime I've really tried to force a deal, they've never ended up well, because you end up haggling over all the minutia. When you have a good relationship, the deal underneath follows, and you're able to kind of work through any problems or issues in a real collaborative way that gets to a solution and not blame. And Rick's always had that mental set in terms of being solution oriented, and that is a hallmark of a really good collaboration within a company and between companies.
Mm-hmm. Yeah, that actually, you answered the question I was going to ask is, what are the skill sets that really create, a collaboration that's going to keep moving forward? And, so Rick, what do you think also are those skill sets when you're looking at, at a potential partner, right, to collaborate with? Frank said that solution driven, and for you, Rick, what do you feel that also, what should the partner also come to the table with?
Well, Angie, I think that the foundation is to set the expectation that it's going to be collaborative. Yeah. And set up mechanisms where the collaboration happens, whether they're standing meetings or whatever. We knew day one that we were going to be a distributed company. We wanted to hire the very best people that were available in the market. And if they wanted to live in Virginia Beach or Spokane, that was fine with us. So the day we opened up, we did everything on Zoom. Mm-hmm. And so we were a very early Zoom user, early Slack user, early Asana user. So we used all the tech we could get our hands on to make it easier for people to communicate with each other. But we set the expectation, that it has to be team oriented and collaborative oriented. Now, we're obviously a clinical company, and the guts of our clinical stuff are peri-op nurses or operating room nurses. We had a data science team in Denver for about a year, but whenever they had a clinical question, they had to Zoom somebody up or call them up. We put our offices in WeWork, which is in the center of Denver, and we finally hired a nurse who worked in that office, and it just took off. The amount of productivity took off, because every time a technical guy had a question about, what's a trocar, what's a this or what's a that, sitting in the next cube over was a nurse who would answer the question. And then as we had to distance in COVID, because we set the pattern of collaboration, they just started doing it on Zoom, right? And we had all kinds of Slack sub channels, including one on adventures in homeschooling for all of our families that had kids at home. So you just need to set the expectation and put some decent tools in place, and then I think people naturally collaborate after that.
Mm-hmm. Empiric is just 3 years old, correct?
Yes.
Yeah. So I'm assuming that you hit this pretty soon. Once you open shop, right?
We did. We established it day one.
Yeah.
Right.
Yeah, because the growth that both of the companies, have experienced, and for any of you out there that have read the Forbes article, it's incredible, this project and the intensity of it. So let me ask you this, because, even the people who are in the audience, some of them we know, some of them we don't know out there when we're pounding the pavement, so to speak, we have many people that approach us that they want a partner, right? And how do you feel that each of you evaluate a potential partner? Because there's a lot of people asking for partnerships, and as we want to be doing smart scaling. But how do you two evaluate that when someone comes to you, approaching you with a proposal for that?
I'll go first. To me, partnerships are what they entail. They're two-way streets. I mean, there's too many companies and businesses approach partnerships in terms of what's in it for me. And I tell the team is what are we contributing back to the partnership? And when we talk to big mature organizations, when we're even working, when we were working with Empiric, what are we contributing back versus the value we're receiving as well? And if it's not a mutual benefit going back and forth, it's really not a partnership. It's a different kind of relationship. And so when those that want to show up and partner and say, hey, let me, give me all this tech for free, but we're not going to do anything from a co-business perspective or any of that kind of aspect, again, I just look at it's not a partnership. It's a vendor relationship. So two-way.
Yeah. Well, then before Rick before Rick answers, then what are you looking at in terms of like that person coming to you, if they want a bunch of free tech, what are you evaluating in terms of the person?
Well, one aspect, that's part of our collaboration, right? We give you stuff to accelerate what you do in the innovation community. But it's also about what have they thought through the joint business value proposition when we go into market, if we go into market together. Have you spent any time there? Is it, and in today's world, you're only a part of a broader solution. You fit into a component. So you have to understand the bigger picture and how you fit into that whole solution matrix across, across a domain, and not just what you do by yourself.
Yeah. Rick, sorry about that. So your turn. I'd love to hear, because I'm sure you get tons of people who'd love to collaborate with Empiric.
First of all, I agree with everything Frank said. My first startup, Neon, was a middleware utility, and we could help anybody anywhere. And so we were very open-ended, open architecture, and would welcome everybody in. Empiric's quite a different thing. It's an end-user solution, focused at surgery leadership. So our first question on collaboration is, what helps us do a better job for our customer? Our customer base is fairly narrow. And so if it helps us do a good job for hospitals generally and surgeons specifically, we're interested. And then the second thing, and this is the toughest thing about being in a young, rapid growth company, you never go home because you're done. You go home because you want to see your kids or, hug your wife or whatever. So you have to be really, really careful about not overscheduling yourself. So we're very tough on prioritization because we're not an open-ended industry utility this time. We're a very specific end user solution, and our clients, have a lot that they want from us. So we have to stay focused, on those things that help the client. And even if somebody's got a great idea, and we see lots of great ideas, but they're not in our wheelhouse. They're population health or primary care or something else or behavioral health, and we go, geez, that's a great idea. We wish we could work with you. But in a 50-person company, you just have to be very disciplined about what you work on.
Mm-hmm.
Well, I'm going to throw something back in Rick's court, but because, the whole business model you created in terms of interacting with customers is truly a collaboration. And I could you add a little bit to that? I mean, you don't have to disclose a bunch
Sure.
of.
Yeah, but I mean, the good news in surgery is it's easy to find. The bad news is, at the end of the day, you got to talk a surgeon into changing their pattern, right? And so, we're very interactive with the surgical teams we work with, and they guide us and point us and tell us that makes sense, that doesn't make sense. And then as we get a community of these folks, we can go to the next hospital down the way and say, look, we were up at hospital X and they pointed this out to us. Does that resonate with you? And so, I mean, that kind of clinical collaboration is extremely valuable. And Angie, I thought your question was more pointed at tech collaboration. On the tech side, we frankly have our tech partner. So our collaboration now is clinical collaboration.
Mm-hmm. Yeah. Alicia, do you want to go to the next slide? Because I think, so, this slide that Alicia created, which is excellent, has a lot of terrific facts in it, the current state of business and healthcare. Now, wait a minute, before I get into that, any of you that have questions, start posting them in Q&A, because we'll start reviewing this, so go for it. But, the current state of business and healthcare, certainly a unique time period. And if we look at these, going through what we're facing right now, how do you feel that both of you jointly serve the healthcare organizations in the middle of this crisis?
Yeah, well,
what's the dream? What's the dream and how you would like to serve?
Well, let's just start talking about the state of the industry, and then I'm going to punt it over to Rick to hit some of these things on what you can do. You can see a lot of the data points here, but what really manifests itself with COVID. And we saw how really connected we are throughout the world, where a health crisis in one part of the world turned into a global pandemic, and then that pandemic really cascaded down. And when you look at the load on the healthcare systems around the world, that first one, it says, hey, we lost 1.4 million healthcare jobs as a result of a pandemic. It kind of boggles the mind from the perspective that we have this demand on a system, but now we're losing critical resources that can serve the broader population and community. And a lot of that was because most of the energy is focused on dealing with the pandemic, and a lot of things that are normal operations for our respective customers really had to be put to the side. Unfortunately, that generated a lot of revenue for them and really kept them very sustainable in a business that doesn't necessarily have a lot of profit margin to it. And so when you look at the extra costs and extra burdens and really kind of forcing some changes in fundamental procedures and how they can even deliver services, it's more than just dealing with a pandemic. It's really dealing with the total upheaval of an industry and what it means to be in the healthcare space, and have to rethink your whole really business model. And same with as a provider. So from that perspective, we got to look at this and say it's not going to be the same anymore, right? Revenue models are going to change. Different types of service models and engagement models are going to change. So with that, I'm going to kind of pause there and let Rick pick it up on the next slide, and we come back to some of your questions, Dave.
Well, I mean, we've all been through this together. Alicia, can you pull up the next slide, please? If we were sitting in January and February having a beer someplace and said, what are your plans for the next 6 months? Almost nobody would have begun to comprehend what we've all been through. So this has terrible implications for the country, economically and politically. It really, really tough on the providers, that were in the front lines. But even the people working from home, the schools shut down. I'd say half the Empiric staff has young kids at home, and so in addition to their job, they're dealing with homeschooling their kids. The kids can't see their grandparents, that sort of thing. So I mean, it's just hard to imagine a tougher situation. We were directly impacted, because we're in healthcare, but one of the first things the authorities did was shut down elective surgeries. So, our contribution to the system is making surgeries, more affordable and better outcomes. But, there just aren't any surgeries. And it was a sort of an odd effect that came out of that. So, I'm pleased to say that all of our clients stuck with us and continued to work on our programs during the pandemic. Surgeons normally are very hard to get airtime with, and you want to show a surgeon's data about how they can improve their performance or get some better patient outcomes. And prior to COVID, we would get it done, but it would be tricky and tough scheduling and flying in to see the doc. We have about 10 peri-op nurses in the company, and they all have privileges. They're still current. And so sometimes in order to see a surgeon, they would gown up, go in and watch the surgeon operate, then talk to him in the hallway on the way back to the break room. It was the only way we could see him. Well, the surgeons, once surgery shut down, couldn't operate, and they couldn't go play golf, and they couldn't go ski, and they couldn't do anything else. So we actually, in sort of the February, March, April timeframe, probably had more airtime with surgeons than we ever had before. And it was all done on Zoom. And we're very good Zoom users. So, we show real-time analytics to the docs on how they're performing. They're typically bubble charts, and we had, a large number of surgeons come on and say, I want to see my bubbles, which is their relative performance on these charts. So that was sort of a lemons and a lemonade. Several of our clients said, look, we're in very hard financial times. Can you suspend your billing for a while or cut it back for a while? So we had to do that, which in a startup is quite tough. And then obviously on the sales and marketing side, these systems, some of them are overwhelmed, like New York City, but even the ones that aren't overwhelmed are using all their available talent to plan for the future. And so we went for about a 90-day period where we really could not do any sales and marketing. Now, luckily, the parts of the country that were had a fairly light epidemic, sort of in April, May, started taking calls again. And we actually closed a sale in New Mexico 3 weeks or so ago, and I'll come back to that later. And we have lots of prospects that are now moving through the system. But our sales pitch, if you allow that phrase, has completely changed from look, we can transform your surgical practice to look, you've lost millions or tens of millions or hundreds of millions of dollars worth of revenue. We can show you how to make every surgery you do, give you an extra $100 or $300 of profit contribution to overhead, so you get healthy quicker. And this is, essentially a playbook on stuff we've seen everywhere we've been, where we know where the waste is. We have things that are not that controversial with the surgeons. And so we've gone from, we're going to transform you to, we're going to triage your surgical financial situation right now on stuff we know that works. So, I mean, just an unbelievable set of stress on everybody and an unbelievable change in the way we all work. So, we were in WeWork, that shut down. But luckily, we're all good Zoom users. We all had laptops, so we were able to, work from home and be as productive as we were. But both from our client perspective and then from our internal perspective, just an enormous amount of stress. And we're going to make a couple of points coming up here on sort of being in this for the long haul. So Alicia, can you go to the next slide and the next slide? This is a Warren Buffett quote. I think most people would, gauge Warren as a pretty good business guy, but the quote is, only when the tide goes out do you discover who's been swimming naked, right? So, you learn a lot about people when they're doing well, but you learn an enormous amount about people when it's tough. And so I think one of the things we've seen with COVID is, really who's in this for the long pull. And so if you bring the next slide up, this is Admiral Stockdale. He was a POW for I think 7 years, and he made it out at the end of the war, and he was being interviewed by Jim Collins for Good to Great. And so as part of their interviews or working along, he said, some people in captivity didn't make it, they died, and some people did make it. What's the difference? And he said, the ones that didn't make it were optimists. Now, I mean, that's really counterintuitive if you think about it. But when you get down into it, he said, the ones that didn't make it got captured, and they said, well, I'll be home by Thanksgiving, or I'll be home by Christmas, or I'll be home by summer. But in fact, Stockdale got out 7 years later. And he said, I was true to my beliefs the whole way. but I never expected it would be over in a hurry, right? And so I think as we think about COVID, a couple of weeks ago, maybe a month ago, we thought, well, Florida got off easy, Texas got off easy, Arizona got off easy, right? And here we are a month later, and they're swamped, right? Now, I hope my kids go back to school in August, September. I hope it's over by Thanksgiving. I hope it's over by Christmas. I hope we have a vaccine by year end. But you know what? You need to be in this for the long pull, because there are some things that have changed that are never coming back. And there's some things that may come back, but it may be a lot longer than we'd like. And those of us that are dealing with it personally or professionally, or running a business that's in the middle of this, you have to do things that set you up for the long pull. And whether it's 3 months or 3 years, we need to be there at the end of the journey. And that's the point of this quote.
I'm just going to add a little bit. There's always during our conversations over the years, and we talk about life as a startup, one of the things you always would say is, well, a couple things. So I'm going to throw them out here. Was one, you gotta be alive to and be in the game. And that's rule number one. So to echo that point, what the game has changed now. So if you're not really kind of future thinking a little bit and looking for where your open ground is, so you can take your organization and run to there in this new world and how everything's really pulling together, then you're doing yourself a disservice. If it's, well, we'll just wait it out 3 months, but then we're going to be out of money, not a good thing. You see what investor characteristics, when we get in situations like this, they tend to pull back and wait and see, one, who's going to emerge, and two, keep their current portfolios alive. So if you're relying on that and saying, hey, we'll just go out and raise money next month, that's somewhat of a bad assumption. You have to have a good survival strategy in addition to a good growth strategy, and always look for where the opportunities come. We were focused on enterprise enablement. Really, Empiric's our gold standard of helping somebody else, create a business of substance. When that, and there's still a lot of good ideas out there, but we had to say, that's on pause right now for a lot of different reasons. The buying customers have put a lot of things on hold. So when we took a step back, we took the opportunity not only to reconnect with ourselves and what we wanted to do, but launched a new service called Research Foundry that accelerated a different kind of business, or accelerated our business model a little bit. So there's always opportunities in this stuff. There really is. And it's up to you as a leader of an organization to figure out where those opportunities may reside with your team, of course, because we're all smarter than one of us, but then really kind of set the tone and direction. You have to really set that cadence, and the cadence for the long haul, and not just a short sprint. The last thing Rick always pounded in my head over the years is, you always meet your expenses, but you don't always meet your revenue targets. In early stage companies, that is so true. So really be mindful of where you're spending money, and it's okay to lean into things, but make those smart decisions.
Cool. We do have a question. Should I go ahead and pose it? Ask it? Can you guys see it? Can you read it? So I'll read it out loud. It comes from Marquis Allen. Thank you, Marquis. Are you seeing healthcare organizations pivot their service delivery approach, market prioritization, etc., to mitigate losses they experience from the pandemic? Is the transition fluid or difficult to most? What have you seen?
I can mostly speak to surgery, and the folks that came out the back end of the curve were given government approval to ramp surgeries, and so we've been assisting in that. And they primarily look at what's safe. So, for example, early up, you wouldn't do eye surgery, because there's too much chance you could get virus that way. And then they're trying to understand how many patients have lost their health insurance, and even though they were on the schedule before, are not going to come in. And we've been guiding them on as you ramp surgeries, where can you improve your profit margin the most by things that A, improve profit, but B, also the patient's better off out the back end of that. Um, the healthcare system is pretty highly patterned. So in terms of shifting your business model a lot, I think that's going to be hard in the short run. However, more strategically in the long run, there are a lot of brittle sort of point designs in healthcare where a room is designed to do only one thing, and it was optimized for that. And I think on a go-forward basis, you're going to see health systems trying to be more flexible, so that as another pandemic happens or as client demographic shift, that sort of thing, you'll see them having multi-use facilities. Obviously, telehealth has boomed, which is a really good thing. There's lots of times where it does nobody any good to get in your car and drive your sick kid down to the office. So I think, in most other parts of our life, professionally we use Zoom. I think you can see a lot of that in healthcare. So I think that's one major change you're going to see. But in terms of repurposing facilities, sort of the patient demand is what it is, and it's sometimes regional. And so you sort of need to gear your facilities to the folks that want to get served. But I do think you're going to see systems being a lot more flexible. Now, many times there's a tension between, the hospital leadership and the clinical staff. And I think having come through this together, I think you're going to see both sides, both the leadership on one side, the clinical staff being a little more cooperative and not being so set on their prerogatives. So in our clients, we've seen, for example, surgeons being much more open to evidence than they were before. So I think that's a good thing.
Yeah, and I think there's been some pressures on the peripheral models. So I'm going to pick up from there, and because there are core things that you're going to need to see your doc. I mean, you're going to need to see your surgeon for a whole lot of procedures, right? We're not doing remote surgery on a mass production scale anytime soon in our home. But conversely, what we've seen is that acceleration of pushing healthcare out into the perimeter because of the need for less contact, for less urgent kinds of situations. Telehealth, telemedicine is one of it, but you're seeing an emergence of a whole bunch of new types of devices that allow for in-home engagement or really all the time engagement. Even some of the fitness devices now are good indicators, particularly ones that measure heart rate of do you have COVID or not. They're up to 80-some% accurate now. And so you're kind of seeing this flurry of new information sources emerge to make the care provider more effective and a more willingness to accept those. So I would say pre-COVID, there was a little bit of a pushback of some of these kinds of technologies because it was almost felt it was a little bit threatening. This is Frank's personal opinion. But with COVID now, it's like really an openness to it. The other thing is we realize how critical health as an economic driver is to other industries. So, travel, we know travel's been shut down, hospitality's been shut down, the restaurant industry has been highly impacted, and we can go down the list. But what's starting to emerge now is health as a core part of my identity to transact in an economy, in a broader economy, and that being a little more transparent. In other parts of the world, these notions of health passes and, have you had COVID or do you have COVID and what's your risk? And we're not going to let you get on a plane without a test and et cetera, et cetera, et cetera. So you're seeing this whole other set of things emerge that produce all these wonderful point data solutions that now have to be coalesced back into care plans and engagement models on a virtual level to couple now with a new kind of contact model on the delivery side.
All right, cool, which actually leads me into the next question. And we had someone kind of ask the similar thing. So they ask, how has everything in the last 3-4 months impacted your people or team? Which is actually, we were going to also ask, how is the layoffs and the furloughs that we're seeing around us? Do you see some changes being made permanent? So how have you guys been impacted, Empiric and also BurstIQ?
You know, when our clients said they needed some fee relief for 3 or 4 months, from a budget perspective, we had to pull our spending down. And so, you know, almost all of our spending is people related. So we went through an agonizing choice of, should we furlough people? Should we lay some people off? And we made the decision to keep the whole team together. So everybody in the company took a pay cut. And the pay cuts were a little higher at the top and kind of modest down at the bottom. It's painful, you know, to see your W-2 go down. But it had the impact of, it brought the team a lot closer together, because, you know, we shared with the staff that, look, we're choosing not to lay anybody off. We're not going to furlough anybody, but we're all going to have to tighten our belts just a little bit until we get through this. And then as our clients start paying us again, we'll go back and restore them. So that was a very tough set of decision making. But in a 50-person company, the benefit of not taking anybody out and keeping everybody together was you know, as much of a morale boost as you can get in these times. Those of you familiar with Slack, the CEO of Slack announced 2 weeks ago that he's canceling all his office space, and they're never going to have offices again. So we were about half distributed and about half in WeWorks in 3 different cities. We're having a serious discussion about, when our WeWork leases wrap up, you know, not renewing them. And then, you know, what we do is figure out how to get a conference room, you know, in a town, and maybe get together once a week or twice a month, you know, depending on where the vaccine is. But it's very clear we do not need an office to be productive. Right. And so, as I mentioned, we were really good Zoom and Slack users to begin with. And so it's possible that we're never going to go back into an office environment. And, you know, the implications of that on, you know, expenses and clothing and, you know, automobiles and, you know, the environment are really quite tremendous. And then finally, I mentioned that all of our clients continue to work with us. Our prior models, we drive to the hospital and hang out with the docs, or fly to the town and hang out with the docs. We're now making very good headway getting clinical change over Zoom. And I think we've gotten really, really good at remote delivery of education and services and those sorts of things. And I think that's going to stick. You know, I think it's still useful to meet people and establish rapport and establish trust. But I think the bulk of our convincing and data evidence and change is going to be done remotely in the future. And I think that's going to stick. We're not going to have to drive to the hospital or fly to the hospital to talk to people anymore.
Mm-hmm. Yeah. Frank, before you answer on BurstIQ, I just want to say I really commend you, Rick, and the rest of the company, and the fact that it brought you guys closer. I think from an employee standpoint, the amount of trust that you got from your team was, I'm sure, immense. You know, they'll probably increase the loyalty as well. So I commend you on that. That could not be an easy decision. Frank, do you want to touch on how it's impacted BurstIQ, or your thoughts and
Sure.
months?
You know, one aspect, I thought we were in a pretty unique position when all this hit. We had really just closed our Series A round, so we had, you know, quite a bit of cash in the bank. We were really looking on how we were going to ramp up, particularly some of the go-to-market team, and made a few hires. But we really, you know, it was towards the end of last year. We said, hey, let's wait till after the new year. So we were running pretty lean as it is from a people perspective. And you know, what Rick said is that as a services company, software development company, a whole lot of costs really reside within the people side of life, as well as if you're carrying a lot of facility costs. And we learned over the years to minimize the facility costs as well, because, you know, that's a big liability on a balance sheet. It really doesn't matter how fancy your office is anymore. In fact, you know, it works nicely at home. And if you can, you know, collaborate on a regular basis and get some personal contact, you know, to augment the virtual contact, you know, that was our model. We were only meeting twice a week in the office as it was. And so to go to mostly virtual with a little more virtual, to go all virtual with a little more scheduled virtual interactions ended up being a really positive thing. And, you know, what helped us is we took a chance kind of on an early movement to really repivot some of our energy. It was, again, a good transition. We were coming to a point in our relationship with Empiric where Empiric had built has built a really amazing team, self-supporting team, needed less of us on the services side. And so we said, hey, can can we accelerate some of our ideas and move them forward and be relevant in this period of COVID? Because it, let's face it, as a platform provider, in what we were doing, say this time last year, isn't as relevant. But if we can really help accelerate researchers and do some things there and move the business forward, and make a contribution, that's what really helped our team stay together and stay focused and really build a lot more camaraderie. And what we found was we were actually a whole lot busier in those first few months than we were previously, because people on the other end had more time to talk to us. So that was a nice thing. We were able to collaborate and to refine and to really come up with new ideas together that made a difference. So again, it's all about where you keep your team focused, I think. And the example you set from a leadership perspective, taking the heaviest pay cuts, that's, do what I'm doing. You got to be willing to do what you're asking everybody else to do.
Well, we have about 9 more minutes left, and they're just to wrap it up. And I think it's fine if we end a little early. And then I have a couple announcements right after this. So I'm hearing a couple things in terms of, what we're calling the new norm, right? And Ricky had talked about Slack had basically announced that they were unloading all of their real estate and their offices. What other things do you think is going to be coming in, with the new norm as startups and as healthcare continues, let's say in the next 12 months, 24 months? What other things do you think are a part of this?
Well, a couple of things I mentioned before. I think we're perfectly fine letting our staff work from home, and we've seen enormous productivity increases since they're not commuting, and I would say the level of collaboration is at an all-time high. So I think that's good. The other thing is, the clients are all working from home too. The administrative staff of these hospitals are working from home. They're on Zoom calls. So I think in terms of communicating with prospects and clients, I think it's going to be a lot more electronic going forward than it was. And I love airplanes. I love the airlines, but I think it's going to be a long time before the airlines come back, because I think we figured out how to get the job done without getting on an airplane. I think that's going to be relatively permanent.
And in some respects, it's made things more human, right? Because of some of the urgency, a lot of the bureaucracy falls away. People are more open to innovation and new approaches, which is a good thing. And when you're working at home, there's an element of your guard, dropping your guard a little bit, because you're not in a conference room with your boss or 5 other people and they're watching what you're doing. And if you're paying attention, are dueling, even though people do have problems paying attention on Zoom sometimes. But it makes you more personal, because there's a little bit more of, hey, how you doing? I'm dealing with my kids today. And so you're able to make a different kind of connection, which accelerates some of the business conversations, because you're building trust. And I think as a new emerging company, as a startup company, you better figure out this virtual sales model. If you don't have a virtual sales model, if you're relying on an old school, I have a salesperson have to show up at account and book a meeting and really go through those traditional cycles, you're not going to make it. I mean, you have to be able to use these tools to accelerate, to get solutions in front of decision makers faster, because they have the ability to make decisions faster and to build up your community and your momentum in a way that doesn't mean I have to be on an airplane and show up. And you definitely got to understand those sales and business models.
So on that note, I'm curious, Frank, what do you think is going to be the key to successful sales virtually?
Well, I don't think social is going away anytime soon. I mean, there's still a lot of noise out there. Really, you got to be able to cut through the noise, and you have to be good at all forms of media. I mean, I hear you hammer me all the time, video, which is true. People, you got to get information to people the way they consume it, in a mode they can consume it. So these kind of media formats are awesome. Reading and publishing are awesome, and well beyond what your product does. It's really building connections and relationships through kind of a broader communication footprint over and above what you do as a business.
Right, right. And it's, video is very effective. Rick, did you have some ideas in terms of like that part? Because I think Frank made an excellent point. It pivots sales a bit, and many of the people here own companies. What else do you think is going to make, success in closing deals virtually?
Well, anybody who's a prospect for a tech company or service company, gets lots and lots of bombardment, right? So you have to have a sort of a headline message to get you up above the clutter. And in our case, I'd like to show you something that saved Intermountain Healthcare, which is a headline, $90 million, which is a headline, right? But somehow you have to get started. And our prospects probably get 50 emails a day from somebody trying to sell them something. So you got to get out of the clutter. But after that, I think Frank's really onto something important. It used to be you were embarrassed if your kid walked in the room when you're on Zoom or your dog started to bark. Now it's just part of being human, right?
Yeah.
And I think those of us who've been through this together, it's driving us a lot closer together. We're a lot more understanding. Where some of the old goofy, out-of-date protocols have gone away, and I think it's a lot easier for people to just be themselves and be straight and honest and be human. And saying, look, I have to, sorry, I have to end the call because the baby's crying or whatever it is. But that's life today, right? And I think Frank's right. It helps you make the human connection. And back before many of you were born, I went through IBM sales school, and the primary rule they drove into is people buy from people they like, right? Yep. Well, they can't like you if they don't know you, right? And if you're projecting some persona that's not you. But if you're on enough Zoom calls with somebody, there aren't any secrets, right? They didn't do their laundry today, or their dog's barking, or get something delivered to the front door. So I think it's a better way to live, and I'm all in with Frank on that. That makes you more human, helps people understand you better, and I think it helps make connections that are lasting.
Yeah. Toilets flushing, no one stands up that, doesn't have pants on. We're good, right?
There are limits. Good point. There are limits.
But then, what you're talking about in terms of what both of you are referring to, which is, it's called social selling. In the social media world, it's know, like, trust.
Right.
They know you, and then they like you, right? And if they like you, they trust you. When they trust you, that is when they're willing to do business. People do business with those that they trust.
Right.
So anyhow, I think it's a good time to wrap up. Frank, Rick, thank you so much.
Oh, I got one more question.
You do? Go for it.
Yeah, because Rick always has a great reading list. What's your recommended book of the day?
I would read Isaacson's The Innovators.
Oh.
So Isaacson wrote the Steve Jobs biography, but his latest piece is the commercial history of the internet and PCs and how collaboration drove the progress.
There you go. That wasn't on my reading list. It's going to be back on my it's going to go on my reading list. So.
Hey, and everybody took an hour out of your day to attend. Thank you so much. We're all in this together.
Yeah, absolutely. Next month, we are going to have the CTOs of Empiric Health and also BurstIQ. That'll be next month. Alicia, do you know the date off the top of your head? I think it's like
Wednesday, August 5th.
Yay. So that will be good. And then the other thing is, I know some of you, I'm sorry, usually we post LinkedIn profiles in the chat, and I'm so sorry we didn't have that today. If you have any questions or you want to follow up, my email is very easy, angie.gallagher@burstiq.com. You can definitely find any of us on LinkedIn, send us messages there. Please, feel free to reach out to us, and hope you come back for the next one. We'll actually show the demo of this product that came out of this collaboration. And as I always like to describe, it's an extremely compelling demo. So anyhow, without further ado, let's wave goodbye to everybody. Thank you so much.
Definitely join them next time. 2 heavy-duty thinkers there.
All right. Cool. Bye. Thank you.